Thank you for tuning into the HACARUS webinar series. Today we'll look into AI in the healthcare area, particularly on AI usage for diagnosis. At the end, a couple of relevant projects we do at HACARUS will be covered, so please stay tuned if you are interested. The agenda for this seminar is as shown. Firstly, an overview of AI in healthcare and diagnosis will be given, and then we will look into how AI diagnosis in particular is being developed. There are many current applications of this technology, despite its being a new field, so a number of current use cases will be introduced, along with future potential applications. Before summarizing this webinar, we will take a brief look at what the risks are when it comes to AI diagnosis, as this is an important point of view where human life is in the spotlight. After reflecting on the key takeaways, we'll move on to introduce a couple of HACARUS projects to wrap up this webinar. So, let's get started on the first topic, an overview of AI in healthcare, and especially diagnosis. In the field of healthcare, AI development and application is accelerating around four key areas. Firstly, the market for AI in healthcare in 2019 was over $4.9 billion, whereas a report on the topic of artificial intelligence in healthcare market with COVID-19 impact, written by Markets and Markets, has projected the market size of 2026 to be a whopping $45.2 billion. The projected compound annual growth rate, that is to say the CAGR, of 44.9% is mainly focused on the four key areas, which are genome analysis, computer-assisted image interpretation, diagnosis treatment support system, and drug development. AI diagnosis is key in two of these areas: computer-assisted image interpretation and diagnosis treatment support systems, which is an intelligent system bridging diagnosis and treatment, ultimately looking to help achieve a more healthy lifestyle. So why is AI diagnosis projected to grow and develop significantly and today receiving so much attention? One major reason this technology is gathering attention is due to the fact that it can solve a number of crucial issues we face today. For example, today we face issues such as supply shortage of doctors, human errors, and the increase of state-of-the-art information. However, with AI diagnosis, anyone can receive high-quality medical services regardless of their location. Furthermore, reduced workload for doctors is possible, as well as medical advancements in new diagnosis and treatment methods, meaning that doctors can spend more time with the patients. So now that we have established the significance of AI diagnosis, how is its development looking? The development of AI diagnosis is said to be in early days. Further development and regulation changes are needed to push AI diagnosis to the next level. Here in this slide are a number of required steps that the Japanese Ministry of Health and Labour have identified. Firstly, an image database needs to be created to supplement annotated data, and relevant standards to ensure universal compatibility also need to be finalised. Furthermore, medical regulations of today have to be modified to accommodate this technology upon its approval. Also, the technology itself is far from a finished article, and further development, including further model creation research, is essential. Upon executing these steps, a practical solution for diagnosis and treatment for common diseases can be developed as the initial widespread application of this technology. As for long-term initiatives, two focus points are shown on this slide. To propel seamless diagnosis and treatment, training data will be needed to be provided to medical device manufacturers to enhance further treatment automation. Furthermore, a diagnosis system for rare illnesses as well as common diseases need to be structured. Such development of AI diagnosis can be evaluated based on autonomy levels, in this case, the Computer-Assisted Diagnosis (CAD) level as shown in this slide. In medical diagnosis, the CAD level consists of 5 levels. Level 1 is feature selection, where likelihood of a disease or probability of cancer can be detected. Level 2 is diagnosis advice based on one feature, which means diagnosis advice is given based, for example, on a single medical image. Level 3 is diagnosis advice based on multimodal information, where multiple medical data is combined to make such suggestions. Level 4 moves up to diagnosis actually performed based on multimodal information. However, in this stage, all diagnosis must still be humanly approved by a doctor. The fifth and final level is automated AI diagnosis, where diagnosis is performed without any human interference. As of today, we are still on level 1, where only feature selection is possible. However, the development is ongoing to achieve higher levels. Although we are still in the early phases of AI development, there are already a number of applications today. Such applications will now be covered, followed by an overview of potential future applications as well. Here in this slide are 4 applications that are already in use today. Firstly, there are chatbot applications. Companies are using AI chatbots with speech recognition capability to identify patterns in patient symptoms to form a potential diagnosis, prevent disease, and recommend an appropriate course of action. There are also applications in oncology, where researchers are using deep learning to train algorithms to recognize cancerous tissue at a level comparable to trained physicians. Applications in pathology include machine vision and other machine learning technologies that enhance conventional techniques. There are also use cases for rare diseases. Patient photos are analyzed using facial analysis and machine learning to detect phenotypes that correlate with rare genetic diseases. Having covered today's applications, in this slide a number of potential solutions using this technology are listed. Detecting diseases will become much easier as AI-based software can tell whether a patient has a certain disease even before evident symptoms appear. Also, classifying diseases will be done with far more accuracy as AI-driven software can be programmed to accurately spot signs of certain diseases in medical images such as MRIs, X-rays, and CT scans. The decision-making process of diagnosis and treatment will also be aided as modern solutions based on AI technology can help doctors overcome research obstacles, process vast amounts of health data fast, and ensure a holistic understanding of a patient's health. Not only diagnosis, but AI-based treatment solutions will also gather attention, as modern AI algorithms are often used to improve surgical robots that execute highly complex operations. A more widespread application of AI-based treatment is to make people live longer. AI can predict our biological age and offer measures we need to take in order to stay healthy. But what are the risks of this technology? Although in the current phase of development the risks are limited, AI implementation with a high CAD level has to be achieved with caution. What can be said throughout the analysis is that a stage of the competency of AI diagnosis has to excess that of humans. How to evaluate this is another matter, but this must be achieved in order to aim for complete automation. A more feasible answer, on the other hand, is a collaboration model where both humans and AI check each other. Finally, the key takeaways will be looked over. We first covered that AI development and application in healthcare are accelerating in 4 key areas, which can be critical solutions to today's issues. AI diagnosis has just started to develop, and further development and regulation changes are needed to push further evolution. However, AI diagnosis already has numerous applications with many more potential capabilities to benefit the world of medicine. In any case, precautions have to be made, as the further the technology develops, the more risks that will emerge. In the final part of this webinar, 2 HACARUS projects will be introduced. Both are focusing on developing AI diagnosis tools. The first project example is the joint research with Kyoto University. The focus is on cervical cancer. As you can see on the right, cervical cancer has been growing rapidly in recent years, and in Japan it has risen to become the most common women's-related cancer type. CIN, a precancerous condition, has explosively increased among women in their 20s and 30s, leading to ever more women in need of care and physical examination. However, today the healthcare system is unable to support this increasing demand due to a severe shortage of special oncologist and colposcopy equipment. To remedy this resource gap, HACARUS and Kyoto University aim to digitize specialist oncologists' know-how, and during the joint R&D project, the 2 parties will develop a solution as following. Firstly, a highly accurate AI model for early cancer detection using colposcopy video data will be built. Then, AI-fueled diagnosis support in line with the diagnosis and treatment standards of Japan will be enabled. Finally, a tool will be constructed that can identify lesions with high accuracy and assist diagnosis of tissue sampling in facilities where specialists are not present. The second project is the joint research with Kobe University on liver cancer. In Japan, some 25,000 people die of liver cancer each year, and it is the 3rd leading cause of cancer death for men over 40 years old. While HCC can be detected early by MRI image diagnosis, a shortage of specialists possessing the required knowledge to interpret the scans means that the healthcare system is increasingly unable to meet a growing demand for diagnosis. HACARUS and Kobe University have started a joint research aiming to remedy the situation with AI. The 2 parties will develop a solution as following. Firstly, risk areas in MRI images using AI trained by supervised learning will be detected. Then, HCC disease type classification in risk areas will be performed. Finally, an accurate AI type classification and diagnosis support system will be created. This concludes today's webinar. Thank you very much for tuning in, and we look forward to releasing further content.